नमस्ते दोस्तों, मैं आपका दोस्त प्राध्यापक सचिन। आपसे आज मैं हॉस्पिटल एंड क्लिनिकल फार्मेसी जो सबसे इम्पोर्टेंट क्वेश्चंस है, उसके बारे में थोड़ा डिटेल वीडियो है, आपको सुनना है, रीड करना है और याद भी करना है। तो आइए शुरू करते हैं वीडियो को।
Explain distribution and storage of NDPS in hospital. ANS. Professor Sachin Sardar. Distribution of NDPS. 1. A separate register should be maintained to record dispensing, and a controlled procedure is used to issue or receive NDPS drugs. 2. Following persons are involved in dispensing. Medical superintendent is overall responsible for the proper safeguarding and handling of narcotics and psychotropic substances. Chief pharmacist responsible for the purchase, storage, accountability and appropriate dispensing of the narcotics and psychotropic substances within the hospital. Head nurse, responsible for the record of proper storage. 1. Prescription order of the narcotics and psychotropic substances should be made by using ink or indelible pencil, typing and duly signed by the respective doctor. 2. Prescriptions for narcotic and psychotropic substances must include the following information: patient's full name, address, date, name and strength of the drug, quantity of drug, signature of prescriber, dose and route of administration. 3. If the required drug is not in stock in the ward, the complete controlled drug prescription must be written on a hospital prescription blank form by a registered medical practitioner, and then it is signed and sent to the hospital pharmacy. Abbreviation like page R. N. Pro re nata or SOS, see opposite, must be discouraged for such drugs. Pro re nata or SOS, see opposite, must be discouraged for such drugs. The completed form along with the empty containers and nurse's inventory sheet is sent to the pharmacy for dispensing. The prescription signed by a registered medical practitioner will also permit the patient to purchase drugs from outside pharmacies. The delivery of narcotic drugs from the pharmacy to the wards and nursing stations must be carried out through some reliable persons. Charges for narcotic and psychotropic substances depend upon the policy of the hospital. It could be like the charges may be made for individual dose received or flat charges for all narcotics and hypnotics. After the dispensing of narcotics by the pharmacy, nurse in charge must prepare special form in duplicate entries to cover incidence of every dose of narcotics and psychotropic substances given, administered to patient, or drug is lost or wasted on ward. Such accountability of controlled substances needs to be furnished to the pharmacy department while requesting for new supply of drugs. Original is filled in the pharmacy and duplicate copy is kept for record to the nursing office. While administering a dose, if a patient refuses or the doctor cancels any dose, it is the responsibility of the nurse to destroy the drug into the sink in record, refused by patient, or order canceled by doctor. Nurses should always preserve a proper record in case of destruction, wastage, contamination. Pharmacists need to preserve the records of the receipt and return of narcotics and psychotropic substances for disposal. Documentation of the return of narcotics and psychotropic substances for demolition by the pharmacist from the respective ward of hospital is considered as good practice of record. Storage. A separate register should have been maintained to register them and record the addition and/or deletions of NDPS in red ink along with their signature. Record borrow narcotics in separate borrowing narcotics administration register. Registered nurses will be responsible for records of proper storage. NDPS must be stored in a separate cupboard with double lock and key. The key of the locks should be kept with two different people. Other than narcotic drugs, no other items are permitted to be stored in the cupboard. NDPS must be procured and stored in such a manner so as to prevent misuse by unauthorized persons. The storage area for NDPS must be opened and accessed by a specific pharmacist in charge and specific nursing in charge of the respective department. Filled circle send completed narcotics administration records to the pharmacy daily. Enter shift count narcotics at the change of shift each shift, in red on the narcotics and controlled drug record. What is floor stock distribution system? Discuss its merits and demerits. ANS. The medicines or drugs are stored in pharmacy and supplied or distributed to the wards or rooms on order and kept under the supervision of registered nurse at nursing station are called floor stock drugs. It is classified further into charge floor stock drug. Drugs which are stocked on the nursing station at all time and are charged to the patient account. An envelope is used to dispense the drugs to the nursing station. Non-charge floor stock drug. Drugs which are placed at the nursing station at all time and for which there may not be direct charge to patient's account. The cost is calculated in the per-day cost of hospital room. Drug basket method or mobile dispensing unit is used to dispense the drugs to the nursing station. The deteriorated, outdated and non-approved drugs and drug samples may be removed quickly through the routine checking of the cabinets. The nursing station drug cabinets are under the continuous supervision of the pharmacist. Less number of pharmacy staff is required. Ready availability of required drugs. Minimization in patient prescription orders at pharmacy. Demerits. It consumes nursing personnel time. There are chances of medication errors because personally, pharmacists cannot take review of requirement of medications. Increase in drug inventory at nursing stations. Special facilities are required in nursing stations for storage of drugs. Chances of misuse of drugs which leads to financial loss. Enlist daily activities of clinical pharmacists. Describe interprofessional collaboration including definition, procedure and its benefits. ANS, daily activities of clinical pharmacist. Ward round participation, treatment chart review. Adverse drug reaction monitoring. Drug information and poisons information. Medication history. Patient counseling. Interprofessional collaboration. Interprofessional collaboration. Definition. The multiple health workers from different professional backgrounds work together with patients, families, caregivers, and communities to deliver the highest quality of care. Procedure. Hospitals encourage patient-oriented, team-based rounds that include the primary doctor, specialized physicians, nurse, pharmacist, and any relevant team members. Pharmacist must accompany physician on medical round to assist him by providing drug information. The physician, pharmacist, and nurses should develop an interprofessional relationship with each other to enhance the quality of patient care. Care team collaboration platform deliver right information to the right people at right time via secure messaging video voice. Assessment and treatment are done together that focus on patient outcomes which can reduce health care cost and inefficiency. It requires leader to put their egos aside for the good of patient. Interprofessional collaboration levels the playing field and acknowledges that everyone plays a vital role on the care team. Benefits. It improves the patient care, safety and compliance. It reduces medical errors. It starts treatment faster. It reduces healthcare costs and inefficiencies. It improves job satisfaction and staff relationships. It reduces preventable ADR, optimizes medication dosages and decreases mortality rates. Write the role of pharmacist in patient counseling. ANS, role of pharmacist in patient counseling. Name of the drug and its action. The pharmacist should inform the patient about not only the name of drug but also its other name. He must explain the use of that drug and action on the body. Route of administration. It is important for the pharmacist to inform the patient about the route of administration of drug, whether the drug is to be taken orally or it is to be applied locally or to be used into eye, ear or nose or inserted rectally or vaginally. The pharmacist should be sure that the patient understands how to use ophthalmic preparations and suppositories. Time of administration. The pharmacist should instruct the patient when to take the medication, e.g. some drugs should be taken on empty stomach, i.e. about 1 hour before meal or 2 to 3 hours after meal to ensure adequate absorption of drug. Duration of therapy. The pharmacist should encourage the patient to continue taking the medicine for the prescribed duration of the treatment. He should explain that the course of treatment must be completed to achieve best results. Storage of drugs. The pharmacist should instruct the patient regarding storage of drugs as per label on the container. The patient should advise to store the drugs in a separate cabinet where children will not reach. Adverse effects of drugs. The patient should be informed about the adverse effects of the drugs, but it not necessary to inform about all the side effects, e.g. headache. The patient should be informed of those side effects which will allay fears and help him to avoid injury to himself, e.g. change in color of urine, drowsiness. Restrictions. The patient should be informed well that he should avoid certain drugs and foods during the therapy, e.g. restriction of tyramine-containing food in patients on MAO inhibitor therapy. Allergic reactions. Before dispensing the drugs like penicillin or sulfonamide, the pharmacist should ask the patient about his allergic reactions in the past. It helps in avoiding further complications of treatment. Removal of drug from package. The patient is not familiar with the packing of the product as the pharmacist. Hence, the pharmacist should demonstrate the method of removal of drug from the package to the patient so that he can handle it properly. 10. Refill information. The patient should be informed the patient verbally whether the prescription is refillable or not. If it is, then for how many times it may be refilled and length of time during which it may be refilled. If it is not refillable, he should be instructed such, so that he may contact the physician for the same drug if needed. 8. Enlist the different softwares used in hospital pharmacy. Explain the use of computer in inventory control. ANS. Softwares. Micromedics, PubMed, Medline, Medlars, Biosis, MEDIPHOR, PAD. The computer can be effectively used for inventory control in the hospital pharmacy as follows. Periodic inventory control system. In this system, inventory of goods is manually checked. The amount of stock in hand, minimum and maximum, can be found out by feeding the data to the computer. Once the stock is entered in the computer, it is helpful for placement of order to each supplier. Perpetual inventory control. In this system, computer maintains running balance of all drugs in the stock. All drugs are entered into the database. When they arrive in the pharmacy, they are added in the initial stock, so as to update the current stock. The current level of each drug is found out by subtraction from the inventory balance. Thus, the computer can list out minimum order quantity of each drug. In this way, computer can help in inventory control. To detect the items those have reached minimum order level. To prepare the list of drugs to be ordered and their quantities. To prepare the purchase order and avoid duplicate orders. Keeping the inventory records for accounting aspects, audit inspections and legal requirements. For automatic updating of price for evaluation of demand. To detect infrequently purchased items for possible return of elimination from pharmacy's drug supply. B. Power the charged stock drugs selected and dispensed to inpatients of a hospital. ANS. The PTC have authority to select charged stock drug. The selected list is constantly being reviewed by the PTC for necessary revision. Dispensing of charge floor stock drugs, envelope method. The patients are charged mostly because of high cost of the drugs. These include injections or other single-dose preparations. An envelope is used to dispense the drug to the nursing station, which is used as charge ticket. The prelabeled envelopes are filled with specific drugs in specified quantity and placed at the disposal of nursing unit. When the drug is administered, the patient's name and room number is entered on the envelope and sent to the pharmacy where it is priced and forwarded to account department for billing. What is an electronic health record? Give its benefits. ANS. Definition. An electronic health record, EHR, is a digitally recorded systematized collection of patient and population health information. These records can be exchanged throughout many healthcare settings. Records are exchanged via networked, enterprise-wide information systems or other information networks and exchanges. Advantages, benefits of electronic health record. EHR provides a summary of the various healthcare events in the life of a person. It collects all accurate and complete information from patient records which help to provide evidence-based treatment. Patient information can be accessed from any place. Data can be easily captured or transferred from one device to another. Errors can be reduced with electronic health record, EHR, systems as all the information is capable of reading easily, which further reduces the risk of miscommunication between system users. 6. EHR systems can be connected directly to medical devices which trigger alerts upon a significant change in a patient's health. The EHR systems maintain patients' information in a more secure manner compared to paper-based systems. EHR increases accuracy and faster diagnosis that determines the most suitable medications for diseases, and monitoring the patient's health in the future. It helps to avoid repeating unnecessary investigations. EHRs useful for tracking and monitoring diseases. EHR helps in selecting the most efficient paths of treatments. It provides effective, safe and efficient healthcare services, and decreases cost of healthcare. It reduces costs through decreased paperwork, improved safety, reduced duplication of the testing and improved health. Enhancing privacy and security of patient data. Helping providers more effectively diagnose patients, reduce medical error and provide safer care. Define radiopharmaceuticals. Give various methods of disposal of radiopharmaceuticals. ANS. Radiopharmaceuticals are pharmaceutical preparations containing radioactive components. Disposal methods. The radioactive waste is disposed as per following. Dilute and disperse. Low-activity solid radioactive waste such as vial, syringes, needles, cotton swabs should be stored in puncture-resistant waste bin. It must be disposed of in accordance with hospital activity. Similarly, liquid radioactive waste with less activity can be disposed into the sanitary sewage system with adequate flushing with water flow. Delay and decay. Radioactive waste with half-lives of less than a month and medium-level activity waste are stored. The storage room is properly ventilated with an exhaust system. The storage space is coated with lead shielding of appropriate thickness to prevent radiation leakage. The radioactive waste is stored for a minimum period of about 10 half-lives. The decay of material takes place during this time. Only 0.1% of the initial radioactivity remains. The waste is then checked for the remainder of the activity. If the activity is low level, it is disposed of as low-activity solid or liquid waste. Most of the low and medium-level radioactive hospital waste is disposed of by this method. Concentrate and contain. The radioactive waste with very high activity levels and for those with long half-lives is disposed of with this technique. The waste material is collected in suitably labeled containers. These containers are kept in one place under monitoring. At once, all containers are buried at the places approved by the specified authority. This method is rarely used for hospitals. Incineration. Long half-life radionuclide waste should be incinerated or deeply burned in soil in a separately marked site, area approved by competent authority. Incineration reduces the bulk of radioactive waste and converts to small quantity of ash or further disposal. Comment on Automated Drug Dispensing System, and Advantages and Disadvantages ANS. Automated Drug Dispensing System. Explanation. It is a medication management system that allows hospitals to store and dispense drugs near the point of use. These systems have drug storage devices or cabinets that electronically dispense medication in controlled fashion and track medication use. Today, automation in drug dispensing includes computer-assisted physician order entry, robotic handling, packaging and sorting of drugs in the pharmacy, standalone nursing unit-based cabinets, the automated generation of customizable reports and forms. Each system and each cabinet is configured slightly different but all operates on the same basic principle. The cabinet look and function much like an automated teller machine ATM. The user inputs his confidential ID, selects a patient profile from a list of options and chooses the appropriate medication to be administered. The dispensing cabinet then unlocks a specified drawer containing the medication, allowing the user access for a limited time. The different protocols can be there for access to the machine, time period for access and how to handle medication errors. Advantages. Commonly need pharmaceuticals are at the point of care, that will reduce the workload of nurses. Controlled substances remain in a secure lockbox until needed. Cost of expired drugs is greatly reduced. Reduction in number of missing medicines. Here, more efficient medication billing. Greater medication security and potential reduction in medication errors. Disadvantages. 1. Remote dispensing creates physical barriers between patient and pharmacist, limiting pharmacists' ability to detect patients' nonverbal cues during counseling. 2. In case of patients taking controlled substances, the lack of physical contact with the patient, the risk of dangerous interactions cannot be avoided. 3. In case of failure of telecommunication services, the system is ineffective. 4. Variety of drugs offered through remote dispensing is limited in comparison to traditional pharmacies. Define unit dose dispensing. Write its benefits. ANDS. Definition: it can be defined as those medicines which are ordered, packaged, handle, administer and charge in multiples of single-dose unit containing a predetermined amount of drug for one regular dose or application or use. Benefits. The patients are charged for those which are administered to them. It reduces the medication error since the pharmacist checks the copy of physician's original order. It avoids drug losses, no pilferage of drug. Less space is required as compared to bulky floor stock. Patients receives the nursing service 24 hours a day. It avoids duplication of orders and extra paperwork. It enhances more efficient utilization of personnel. It eliminates labeling error. Drug accounting become easier. Better financial control means credits are eliminated. There are no more articles to read.